I will summarize a few highlights from the Global Nutrition Report. And the first one is that poor diets and malnutrition in all its forms remain unacceptably high across the world. So not just in Africa, but globally. Secondly, over the last 10 years, we haven't seen an improvement in our diets. They are now a major threat to people's health and the planet. The third thing is that the financial costs of addressing malnutrition are rising, but the cost of inaction is even far much greater. And lastly, I want to just say that this is the nutrition year of action, and the Global Nutrition Report has also put forward a nutrition accountability framework. So it's an opportunity for decision makers to leverage on this for accelerating nutrition efforts.
What is the state of nutrition in Africa, and are there some significant changes from previous years?
The global situation is really dire. Generally, we are off course for 5 of the 6 maternal, infant, and young child and nutrition targets, and we're also off course to meet all the non-communicable disease diet-related targets. In Africa, we've seen mixed progress towards achieving global nutrition targets, and no country in the region is on course to meet any of the diet-related non-communicable disease targets.
So what are some of the main drivers of malnutrition on the continent?
First, I'd like to say that nutrition is a complex issue. So we have immediate causes of malnutrition, we have underlying causes of malnutrition, and then we have basic causes of malnutrition. So the immediate causes of malnutrition are poor diets and disease. Then the underlying causes of malnutrition are such as household food insecurity, and the basic causes of malnutrition are things such as access to resources such as land or income, and gender norms and barriers. So there are lots of things that kind of work together to cause the complex issue of malnutrition. So the immediate causes, which is what I want us to focus on, are poor diets and disease. Just to focus a little bit on Africa, as a result of COVID, the situation has been further exacerbated. For example, we've seen an increased number of people who are more undernourished in the last year also as a result of COVID. So generally, we have a bad situation, but COVID has exacerbated the situation even further.
Given that there have been some drivers, you mentioned 3 different levels in the past, even before COVID, and now we have COVID. So in terms of solution, where do we start?
First, I have to say that malnutrition is solvable. There are a number of things that we can do to tackle the issue of malnutrition. So the first thing that we can do is really accelerate the efforts towards addressing the different issues around malnutrition. So just scaling up, making sure we're implementing nutrition programs at scale to make sure they're reaching all the vulnerable people, everybody who's intended to be reached by the programs are being reached. Then secondly, we have to make sure that poor diets and malnutrition are addressed holistically in a way that they ensure a healthier future for people and the planet. So we are not addressing malnutrition at the expense of our planet. So we have to make sure that we are able to kind of address the future, the healthy future of our people, as well as making sure that we're tackling the climate change issue and not making it worse. Then I talked about financing. So we have to come up with innovative ways of kind of making sure we have the resources we require. Then lastly, again, I talked about the nutrition accountability framework. We have to make sure that people are making commitments that ensure that impact can be measured and that we're able to trace or track the nutrition.
What are the main takeaways for you from the 2021 Global Nutrition Report?
The main takeaway is that, one, we have all this data that is not very encouraging, but this data should certainly catalyze action. So the point of this data is not just to show us how bad the situation is, but it's really to invigorate our efforts into tackling the problem of malnutrition. The other thing that has come out of this report is the issues around making sure that we have adequate financing for nutrition. So for us to effectively shift the global nutrition target, or just making sure that we are able to meet our targets or at least move towards the target, we have to have adequate resources to tackle the problem of malnutrition. So making sure we have different ways of fundraising and make sure we have adequate funds to tackle the malnutrition problem.